So my name is Heather Shelton, and I'm a nurse herbalist, and I specialize in cannabis therapeutics. I've worked with botanical medicine for over 2 decades and specifically with cannabis for the last 10 years. So today I'm going to talk about the art of the intake. And as nurses, we've all had to fill out admission paperwork, triage forms, new patient history forms. There's a lot of important information that comes in these admission forms and intake forms. But there's a lot of information that's really not necessary. So over my last 2 decades of practicing alternative medicine, I have found that these 4 words really give me the most information about my patients. I've gone through at least a dozen intake forms over the last 20 years. And when I began, each one of those forms was 8 to 10 pages long. And really what I found is no one really wants to spend time writing a 3-day diet diary before they even meet the practitioner that they're going to work with. So every few years I've adjusted my form, and every year they become shorter. And what I've learned is the information I really need to know is, who is this person, right? What is it that they're here to see me for? Each patient is unique. Their goals and life situation are unique, and often their particular health issues are different than anyone else's. Cannabis medicine is patient-led, and individually based treatment is critical to success with cannabis. We learn as nurses to meet people where they are, and I feel that their story really gives us that information. So of course, in every intake, there is information, factual information that we really do need to know to be able to serve our patients in a safe and effective manner. So the medication list, this is really critical, actually. And as nurses, we want to be able to look at medication lists to see if there's potential drug interactions we need to pay attention to. When they start their cannabis, we just want to advise them, if they feel dizzy or lightheaded, please take your blood pressure, monitor your blood pressure. You may be able to decrease a pharmaceutical. This is one of the ways that we keep our patients safe. And looking at a patient's medication list, as nurses, we're able to really look at that and figure out pieces of patient history that they might not think are important to tell us. You know, if we see a patient on glyburide, right away, we're going to talk about lowering blood sugar, right? That's one of the side effects, although beneficial effects, in my opinion, of using cannabis, is that it can lower blood sugar over time. But these patients really need to know that their blood sugar could drop over time, and to make sure that they're continuing to monitor. So medications absolutely are something that we need on our intake form. Diagnoses are important as well. Why are the patients coming? Again, this is a place where if we know the conditions that they're living with, we're going to be able to give them the best education in how to use cannabis safely. I work often with cancer patients, and the diagnosis for me is really critical because there are so many different types of cancer. I like actually the specific diagnosis that their doctor has given them on a piece of paper, because that allows me time to research each type of cancer. And as the years go on, I learn more. I don't have to look them up every time. But there are new diagnoses coming out all the time. So I find that to be really important before I even meet the patient. So I like to also ask about goals. What are their goals in working with cannabis medicine? Are they here because they have cancer and they want to manage side effects? Are they here looking for pain control, sleep? What's the goal in coming today to talk about cannabis as medicine? And demographics. And I put that on the list here because I have had at least a handful of times, especially in the beginning, where I forgot to ask those questions. And so I end up with a client, and I want to get back to them about something, and I don't have their phone number or a way to get in touch with them. So demographics, always important. These 4 things are things I like to have from the patient before we actually even have our first meeting. So the story, how I get into the story with a patient really is, I've gotten my initial intake information, which were those facts, right? And then we come in, we meet, introduce one another. I've now learned to explain what the process is for me with the client, so they know what to expect. And then I ask for the story. Tell me your story. And it gives me so much information. And just some of the things that I learned from listening to a patient's story is I learned their fears. Reefer madness runs so deep in our country and all over the world. So a lot of folks have a fear of getting high, a fear of dying. Sometimes they have a fear even coming to talk to us, you know. They may have fears that are not related to the cannabis, but that are still really important to address, right? Because when people feel fear, they're really not able to tap into the other parts of their body and spirit. So we learn about people's fears. We learn about their support staff. Who is their support? I've had folks talk about having great support from their family, but really for a mom, very often the family still expects her to play the role of mom, and she's going to feed us and help care for us. And so that's not really the type of support that I'm thinking someone who's going through their cancer journey may need. So learning about really who is the support they have, and are those people really supportive? And readiness for change. This is actually my favorite nursing diagnosis for cannabis medicine. I feel that anyone who's coming to have a consult with me absolutely has a readiness for change nursing diagnosis, because they're probably not getting guidance on cannabis medicine or herbs and diet and lifestyle, which are all things I talk about with my clients as well, from their mainstream medical doctors. So just coming and asking for an appointment to me lets me know that they are ready for change. So how does the story actually guide the individualized care? Well, it allows us to see each patient as an individual, to hear their story, to know what their fears are, to know what their loves are, who they live with, what do they do, what's important to them. And by learning these things through the story, then I'm able better to really ask my questions that are specific for this type of patient, right? Through the story, I can learn, is this someone that I can really talk to about their diet? Or how am I going to talk to them about their diet, right? We're going to meet people where they are. I recently had a client who, instead of eating ramen with the little packet you get, she was having ramen in bone broth that was actually cooked with other vegetables, organic beef bones. So even though we didn't totally change her diet, we were able to make some health promoting changes that were individualized for her and meeting her where she is. Pain, individualized care with pain control. What are people willing to do? Do they want to have THC? Where can we start? And I learn where we can start with a patient through their story. If someone is very fearful of THC and the experience of getting high, we don't start with THC. We start with a high CBD product. So it's really looking at the patient, where they are, what can we do, and the resources. Each person needs different resources. And I really feel it's our responsibility as healthcare providers and nurses, the most trusted profession, to help our patients to find the resources that best fit them. So local resources, support groups, even online. And I believe that the art comes from interacting with each individual and meeting them where they are at and supporting them on their healing path in whatever direction that may lead them. And the use of the art of the intake really does help get us there. So we need to listen. People start to heal the moment they feel heard.